Thank you. So today's presentation is integrating executive function strategies with floor time developmental capacities, a pathway to holistic growth. We have two presenters this morning. The first is Andrea Snyder, and she's an occupational therapist and DIR floor time expert and trainer from Colorado Springs, Colorado. She offers floor time services to children in their homes, partnering with families to support social emotional development. And by focusing on each child's functional emotional developmental capacities and individual differences, she strengthens skills through natural, playful experiences and interactions with their everyday environments. Our second presenter this morning is Ms. Naomi Wong. She is a speech therapist and DIR floor time trainer from Singapore, who recently taught a DIR 101 in Mandarin to participants in China. Through her private practice, Speech Therapy Adventures, she guides parents and children on unique journeys, fostering playful interactions, and transforming traditional speech drills into exciting experiences using floor time strategies. I turn it over to both of you ladies.
Hi, everybody.
Hello.
We're so glad that you can be here and join us early in your morning. Yep. So today we will be talking about integrating executive function strategies with floor time and functional emotional developmental capacities, a holistic pathway for growth. So, um, Yep, so we would like you to explore how we can together look at functional emotional capacities today and sort of look into deeper insights and supporting executive function development. So by making connections between executive function skills and also FEDCs in terms of floor time, now we can not only enhance a child's cognitive capacities and organizational growth, but we can also allow them to thrive both academically and socially. So today we are going to look at how executive function skills align with FEDCs. We are also going to think about practical ways to develop executive function skills through targeted activities within each FEDCs. And we are also going to look at the crucial role of precursor skills and individual differences, especially in integrating sensory integration and motor planning. So my hope for us today by the end of our 90 minutes is that we are able to have a clearer understanding on how to blend these two concepts into a cohesive strategy for fostering development in children. So let's start by taking a look at what executive function is. So if we think about executive function, we think about maybe we start with the definition of it. So executive function is a multi-dimensional umbrella construct that includes a collection of interrelated functions responsible for guiding, directing, and managing cognitive, emotional, and behavioral functions, particularly during active, novel problem solving. So another way of looking at executive function can be a generic term that refers to a variety of different capacities that enable purposeful, goal-directed behavior, including behavioral regulation, working memory, planning, and organizational skills, and self-monitoring. So as you can see, all these nice things like working memory, planning, organization skills are essential for daily management uh, and academic functions and academic success, particularly in school age children, and beyond that, even for adults like all of us, to be able to plan our daily life, be able to manage our careers and our chores at home, all these things we need executive functioning. Just in case you're wondering, like, how did Andrea and I become so clever in figuring out executive functioning, we have help from this Smart But Scattered guide. So if you are thinking about having a reference to look at, so we'll recommend this book, although we have to clarify that this book doesn't quite exactly teach you how to correlate executive function skills with FEDC. So if you are thinking about correlating those both concepts together, you are better off looking at the notes from this lecture. But the Smart But Scattered guide would be a good place to start for executive functions. So in the Smart But Scattered Guide, it highlights 12 executive function skills that is required. So these are, let me just briefly go through them with you. So response inhibition. So we are going to take time to think about our choices before acting impulsively. Working memory, the ability to keep track details. So emotional control is the ability to stay calm under pressure. Task initiation, this means that we are going to start efficiently and prevent procrastination. Sustained attention means that we are going to focus on our tasks and not get distracted. Planning and prioritization means that we are going to have efficient planning so that we can finish our task on time. Organization means that we are keeping our spaces and our thoughts in an orderly fashion. Time management refers to our ability to get things done in a timely manner. Flexibility refers to our ability to cope with change. Metacognition is our ability to think about our own thinking. And goal-directed persistence is our ability um, be able um, to pursue and continue to finish our goals. Stress tolerance is our ability to remain calm and cope with stress. So, if we are thinking about how we are able to put these concepts together, we have to think about um, we have to think about the development of executive functions. And if we are able to put them together with FEDCs, then we can really enhance our therapeutic outcomes. But as floor timers, we need to be very aware where this skill lies. This skill lies at the tip of this pyramid that we see here, right? So as floor timers, we know that we have to support that broad base and make sure that we are always expanding it, always keeping that support in mind. So if we are able to think about where executive function lies within this broad-based pyramid, we would be very successful in integrating it into our therapeutic goals. So as we work with the children to integrate executive function skills in therapeutic settings, we need to be practical in using executive function skills. We need to have practical strategies in doing so. But more importantly, we need to maintain that relationship-based approach in therapy, so also known as floor time. We have to use it in that floor time manner. We need to be able to look into that development of that child, honor their individual differences. We are also going to have that co-regulated relationship with them, so keeping that relationship going. So in doing so, we will be better able to help them grow that ability to manage life better and also have that better academic performance that we are hoping for. So we're going to shift lens to FEDC. So over to you, Andrea.
Thank you. So we are going to talk briefly about the overview of floor time and the FEDCs, the functional emotional developmental capacities. But first, I want to just kind of highlight the learning tree. And this is Naomi and mine's adapted version of the learning tree. And you can see here how it overlaps with the pyramid that Naomi was just talking about, where we have those roots as those foundational components of regulation, looking at the sensory components, the biomedical factors, which then in turn moves into the trunk of the tree, which is our functional emotional developmental capacities, our FEDCs. From there, the roots pull the nutrition from the soil to feed the tree, to then allow all of those leaves and the fruit and the branches to grow, which is going to lead into those higher level executive functioning skills that we are talking about. So you can see through this visual that we have to have that foundation of the roots and the trunk of the FEDCs in order to support our children in the development of those executive functioning skills. Okay, so when we're thinking about floor time is that intervention model that focuses on the child-led play and interactions, which then in turn supports the child's emotional and social development and growth. So Floor time involves the therapists, the parents, the clinicians, the caregivers in the child's life, joining their children in their natural interests, supporting a series of progressively complex interactions that support and nurture the emotional, social, and intellectual growth of the child that we're working with. So by supporting our children in their natural interests, we're providing that intrinsic mobilization of their development, of their social development, their emotional development, but then turning into leading and guiding into those cognitive development skills. So when we're thinking about the development, we want to look at the functional emotional developmental capacities. And these FEDCs kind of outline that developmental trajectory of the social emotional development of the children that we're working with. It maps the child's growth across a broad spectrum of those emotional and cognitive capacities and skills. And these capacities start with that self-regulation. Like we know, FEDC1 is where we look at that self-regulation and really supporting and fostering that development for our children, which leads and guides our children and progresses into more complex interactions to include social, emotional, and cognitive skills. So each capacity serves as a building block for the next, ensuring that comprehensive developmental progression in the children that we're working with. So floor time, we know, is not only enhances the social communication skills, but it also fosters that comprehensive growth across the child's social, emotional, and cognitive development. And by supporting the child's individual differences and nurturing the relationships through that child-led play and interaction, this floor time facilitates the development of essential executive functioning skills that are linked to those social communication, empathy, and problem solving. So we're going to compare the list. So Naomi already went over the 12 key components of executive functioning. And then on the other column, we have our FEDCs, our functional emotional developmental capacities. And you can see through this list, and we'll talk about it more a little bit on the next slide, there is a lot of similarities, a lot of areas that are very much aligned with each other when we're thinking about our functional emotional developmental capacities and our executive functioning skills. So comparing the lists a little bit more, when we look at this, so we start with FEDC 1 through 6, we want to make sure that we are being aware that within FEDC 1 through 3 primarily, this is really the foundation. This is where we want to make sure that we are fostering the growth and development of these FEDCs in order to help support that foundation for when our children move into the skills that are going to help to build their executive functioning. So we don't necessarily see these executive functioning skills in FEDC 1, 2, and 3, but it's crucial in preparing the child for the development of those executive functioning skills as they progress developmentally. So by supporting 1, 2, and 3, it's going to allow our children to naturally integrate these skills as they begin moving into the higher FEDCs of 4, 5, and 6. And once we begin moving into FEDC 4 and beyond, this is really where we start to see those executive functioning skills starting to develop and grow in the children through the support of their functional emotional developmental progression as well. So why is it challenging? Where does the challenge come in aligning executive functioning with our functional emotional developmental capacities? So we want to consider why this can feel so sticky to align these two components. Both executive functioning and the FEDCs include the management of thoughts, actions, and emotions to achieve goals with our children. So first, we're going to compare and contrast the executive functioning and the functional emotional developmental capacities. So executive functions are crucial in the development as they govern our children's ability to process information, manage their emotions, and execute complex tasks. The focus on the FEDCs, however, are a little bit different, as we know through our floor time practice. Our FEDCs are more emotionally driven and interaction focused in the play and in our interactions with our children. So with this, our executive functioning skills typically develop through specific and oftentimes more structured experience in specific social and academic contexts, which doesn't naturally align with the more emotionally intrinsically driven interaction focus of our FEDCs. So, as we've kind of talked about so far, the structured nature of the executive functioning skills and development often contrasts with the more fluid dynamic interactions that we see when we're supporting the FEDC development, which can create that misalignment in the interactions and the strategies that we might want to incorporate and use to support both the executive functioning and the FEDC development in our children. Okay. So there's a variability within the developmental timelines as well. As we saw in the last slide, there's that difference. Not all of these skills align at the exact same time. So our executive functioning skills and our functional emotional developmental capacities don't necessarily follow the same developmental trajectory or timeline. And it becomes clear that just like our FEDC development in our children, those executive functioning skill development in our children is just as unique. So just like our children's personalities, their cognitive and emotional growth doesn't follow that universal timeline. Every child is on their own developmental trajectory, and every child is on their own developmental progression with both their executive functioning skills and their functional emotional developmental skills. And so we want to make sure that we are being mindful and supporting those unique trajectories and developmental profiles. So with that, and with the differences in the executive functioning and the FEDC development, we want to make sure that we are being mindful of the fact that a child that we're working with may demonstrate skills excelling in those structured problem solving, but yet have challenges or constrictions with the emotional reciprocity required in social interactions. So thinking about cognitive problem solving versus more of that shared social emotional problem solving and the differences that children may be experiencing with those two skills. So when we're thinking about this variability in the developmental timeline, this uneven pace or this uneven developmental trajectory can create a mismatch in the child's ability to manage their cognitive tasks and their social and emotional understanding at the same time. So, for example, we might see a child who is able to plan and organize an individual project in the classroom setting, but they might find it challenging to navigate those social dynamics that are involved with group projects or peer interactions on the playground. So when we're thinking about intervention and support and how can we help our children to grow and foster and develop in both their executive functioning and their FEDCs, we want to make sure that we're looking at the complexities of applying a balanced approach that doesn't overly favor one area of development or another. So we want to make sure that we are creating and fostering effective interventions that are going to both enhance the executive functioning skills in our children while fostering and growing that emotional and social development that's appropriate to each child's executive functioning and FEDC level and timeline. Okay. So one of the primary challenges that we see is that interventions to support both the advanced and emerging skills of the child. So if we have a child with that variability or that misalignment in their executive functioning and their FEDC, how do we support the development of both simultaneously? So we want to make sure, so for example, we have a child who is advanced in their planning and organization, but is still growing and developing in their emotional regulation. We like, for anyone who has seen Inside Out 2 or Inside Out, we know that this is a beautiful movie that shows lots of that variability of emotions. And Inside Out 2 introduces the character of anxiety. And so we might have a child. So if we have a child who has strong planning and organization skills, but is still growing and developing in their emotional regulation, this might look like anxiety in Inside Out 2, where anxiety is always planning, always preparing, always wanting to have a say in everything that happens in Riley's life, always wanting to make sure that she knows what's next or what can I do. But on the flip side, anxiety is not necessarily considering the emotional results or the effects of the constant planning and preparing on Riley's emotional regulation and her social interactions. And so we want to make sure that when we're thinking about those interventions, we want to make sure that we are not only challenging our children's cognitive abilities, but also supporting their emotional and regulatory needs and development without causing that frustration or disengagement. Okay, so we need to make sure that we're thinking strategically about how we're going to integrate these domains. So this might involve activities that combine both problem solving with social interaction, such as cooperative games or projects that require both planning and empathetic communication and reasoning. So these activities, when we're thinking about therapeutic intervention or activities to incorporate, they should be designed to help the children practice both their executive functioning skills in contexts that also support their social and emotional engagement, okay? So we are going to look at an example. And so we're going to just kind of give you a general example of a child that you guys may have seen in your clinical practice, in your classrooms, in your settings. And we're going to keep this child in the back of our mind as we start to move through that integration of the FEDCs and the executive functionings. So our child is a 5-year-old. The parents come in with chief complaints or concerns about this child having difficulty waiting for his turn. The child is very competitive, hyperactive, and inattentive. He struggles in class. He does not sit still in class. He moves around, fidgeting, which oftentimes results in complaints and concerns from his classmates. However, in a one-on-one setting, this child excels. He does very well, and we aren't seeing the same concerns that we do in the classroom setting.
All right. So let's start by looking